Hello everyone, I am Dr. Ramitha Bhat, Paediatric Haematologist Oncologist in Sri Shankara Cancer Hospital, Bangalore, and today I will be speaking about various aspects of nutrition in Paediatric Oncology patients.
Hi everyone, my name is Sameera Magandi and I am the Paediatric Oncology Nutritionist here for Sri Shankara Cancer Hospital from Cuddles Foundation. So today we will be answering a few questions on how to take care in Paediatric Oncology. So ma'am, what is the importance of nutrition in Paediatric Oncology?
As such, any growing child requires adequate nutrition for achieving growth and development, and especially any child with cancer requires more adequate nutrition, like in the form of high calorie dense diet or high protein diet, because the body is healing itself from the toxic effects of chemotherapy. So a child suffering from cancer and undergoing chemotherapy requires a good amount of calories and high protein diet to recover from the chemotherapy side effects. In India, it is a major hurdle in achieving remission or getting cure from the cancer, because most of our children are malnourished, and the outcome of cancer, it depends on this nutrition, because we are not able to give chemotherapy on time, or we may have to reduce the dose of chemotherapy sometimes because the children are malnourished and they face a lot of side effects. So their outcomes are slightly less compared to the Western population, and nutrition is a major hurdle in this. So giving adequate protein and calorie-rich diet is very important in pediatric cancer patients. So Sameera, you are the nutritionist here. So could you please tell us anything about the special diet which the pediatric cancer patients have to follow?
So for cancer, pediatric oncology specifically, in cancers, we give high calorie, high protein, as you've highlighted before, but apart from that, there is something called neutropenic diet and sterile diet. So what happens in neutropenic diet is that there are some specific restrictions in order to prevent bacterial infections through food to the kids. Now, what are those restrictions? Initially, first of all, you're not allowed to consume any raw fruits or vegetables, and if you're consuming any fruits, they should be thick skinned, they should be thick peeled, something like bananas, watermelon, or even oranges, mosambi, anything of these sort of fruits that have thick skin or thick rind can be consumed. Apart from this, all meat and meat products should be thoroughly cooked, well done. They should not be medium rare or rare in any way. They should be well done meat, and not even runny yolks in eggs are allowed. Apart from that, we can give any other food. Also, when it comes to milk and milk products, all milk products are supposed to be consumed that have been pasteurized alone, and should not be consumed if they have any live bacteria in them, like some fresh cheeses or fresh curd. Instead, look for anything that has been pasteurized. It's written always on the label.
So commonly, the most common question that parents ask us is, can we give dry fruits to the kids? So what do you want to say about that?
So dry fruits can always be given. They are a very good source of protein. They are a very good source of fats and other vitamins and minerals. But however, you can't consume raw nuts and seeds as such. You either have to roast them thoroughly, or you have to boil them nicely and then give it to the kids.
Okay. So one more question which the parents usually ask us is, can we give non-veg to the kids?
So non-vegetarian source of protein is a very good source of protein, and it is considered to be class 1 source of protein. And this source of protein helps us build a good muscle mass. Yes, meat can be given, but then it should be cooked thoroughly, as we've discussed before. Apart from that also, there is always a chance of parasite infestation in the meat. So it's best that we cook all the meat thoroughly, pressure cooked, so that all the microorganisms, parasites are dead because of the cooking method.
So could you also tell us anything about high protein foods which children can consume?
So foods high in protein as such are milk and milk products, and all the pulses and legumes, all the dals, chana, chole, peanuts, all of these, they fall under pulses and legumes. These are vegetarian source of protein. Even soya, they fall under pulses and legumes. Apart from this, we can consume meat and meat products like eggs, chicken, fish. All these are very good for protein. Apart from this, paneer can also be consumed, tofu can also be consumed, soya nuggets are also very good source of protein, vegetarian source of protein, and nuts also provide amazing source of protein.
So some of our pediatric oncology patients undergo bone marrow transplant, which could be autologous and allogenic both. So do these kids need any other special kind of diet?
So yes, as I've mentioned before, there are two types of diet, neutropenic and sterile. So in bone marrow transplant specifically, we use the sterile diet. Now what is sterile diet? It is similar to neutropenic diet, but in sterile diet, we do not give milk and milk products, and here at Shankara, we avoid any meat and meat products in order to avoid any bacterial infections or to avoid any parasite infestations. Apart from that, everything is allowed as compared to neutropenic, and only packaged pasteurized fruit juices are allowed. So what happens a lot of time in neutropenic diet is that we are allowed to give them hot ganji and hot ragi ganji, hot rava ganji, which is freshly prepared. But then that is not allowed in sterile diet. So what are the challenges that are faced in pediatric oncology, specifically related to diet?
So basically any child should have a good nutritional background whenever they come to us for treatment. If the child is already malnourished, then that is a huge problem for us for delivering good dose of chemotherapy, because they will not tolerate the chemotherapy well, and they're going to face a lot of side effects, and because of which we may have to reduce the dose of chemotherapy. And during the treatment, these children can have a lot of side effects. They can develop pain, they can develop loss of appetite, they can develop taste changes, and they can develop some mouth ulcers, any ulcers in the gut, and that can lead to nausea, vomiting, diarrhea, constipation. All these can reduce the food intake drastically. And when nutrition is not given properly, again it is like a cycle, like you don't give nutrition properly, child will become malnourished, there will be like chemotherapy side effects, we have to reduce the dose of chemotherapy, then again it's like a cycle. So like at the end, the outcome of the cancer due to the treatment, it will be low. And child may not recover well.
So in order to tackle this, do we have any other modes of nutrition as such?
So as such, enteric diet is preferred, that whatever is given orally. We can give various kinds of supplements which are high in protein and calories. But if the child is not able to take anything orally, we insert something called as Ryle's tube or nasogastric tube. It is a small tube which we insert through the nose down the food pipe into the stomach, and through which calorie dense supplements, high protein supplements is usually delivered. And apart from this, we can also deliver the nutrition through intravenous route, that is called total parenteral nutrition. It is a mixture containing proteins, carbohydrates, fat, vitamins and minerals, and that is given through the intravenous route. So some of our patients, especially in our bone marrow transplant patients, usually require this total parenteral nutrition, which is given through the intravenous route. Sameera, is there any specific guidelines or anything which you want to tell to the parents how to take care of their children at home during the time of chemotherapy?
So there's something called food safety guidelines which should be followed during the treatment of cancer. So things that we can do, things that we can't do. So let's talk about things we can do right now. So first of all, it's important that we ensure that we are washing our hands before cooking a meal, after we cook a meal, before feeding a child and after feeding a child thoroughly with the soap for at least 20 seconds. Now, the second thing is to give the child ghee. Ghee is a very good source of fat. It's a very good source of calories that gives us energy. So, in order to tolerate the chemotherapy, it is important that we give 1 teaspoon of ghee with all meals in the child's diet. Apart from that, eggs. We swear by eggs because eggs are first class proteins and they're like easily available in any place. So eggs have a very good source of protein, and including them into your diet will help us increase our good muscle mass, through which we can prevent something called sarcopenic obesity. So that helps us increase our good muscle mass, lean muscle mass, and help us tolerate the chemo better. The other thing is to wash fruits and vegetables regularly, thoroughly before we cook. Apart from that, it is also very important that we serve all the meals freshly cooked, hot, when it's freshly cooked and hot and we're serving it to the kids. Apart from that, it is also like very important that we use the locally sourced grains. Like, let's say in Karnataka, ragi and jole is something that is very often used. Even bajra, all of these, they are very, very often used in the rural parts, and these are grown because they are grown and they are cheap sources of good calories, fiber, protein, minerals that our body requires. And coming to water, water is something that we have to drink on a daily basis in increased amounts due to the metabolism. And apart from that, giving water the way is very important. So boiling water before we give it to the child is very important. It's not necessary that they have to drink hot water alone, but it is important that the child drinks water that has been sterilized. Yes, so that is something. And apart from that, we can also, while buying something for the child, something packaged, even dals or anything like milkshake or something, it is important that we check the expiry before buying the product. And now about what shouldn't be done is maybe to not give a lot of space between meals. You know, having short, frequent meals can help us increase the calorie to another level as compared to having three specific meals in a day. Also, consuming food that is highly, like processed, for example, maida, chips, puffs, bakery food, all of these is not good. Definitely not good even for normal kids. However, specifically with pediatric oncology, it is avoided in order to prevent sarcopenic obesity. Again, this comes into picture. What is sarcopenic obesity? Sarcopenic obesity is lean. There is no lean muscle mass in the body. It's only the fat. So we do not want that. In order to tolerate chemotherapy, we want good muscle mass. Yes? So apart from that, we also should not give them raw fruits and salads, Chinese foods, cut fruits and vegetables that is available on the street side, any processed foods, which brings us to what fruits and vegetables can be had. Fruits and vegetables are healthy. What fruits and vegetables can be had and cannot be had? Like I said before, thick-skinned fruits like banana, orange, mausambi, papaya, muskmelon, dragon fruit, all of these can be allowed. Now, fruits that are not allowed are jackfruit or pineapple or apples, berries. All these fruits, they are highly prone to microbial infections and parasite infestations and all that.
So diet is a very important part of treatment of cancer chemotherapy because that is something which the parents can control, and they usually have a lot of questions regarding what diet to follow and what can we give, what we cannot give. So some of the things which we are not supposed to do is, one is they give a lot of herbal medications which claim to have some control on the chemotherapy treatment. So these medications, especially herbs, everything should not be given because they can have some interactions with the chemotherapy medicines which we are going to give, and that is going to increase the side effects of the chemotherapy itself. Secondly, there is a myth that we should not give high protein and high sugar diet because this protein and sugar will help the cancer cells to grow. So this is again a myth because usually a growing body requires a good amount of calories and protein and to repair itself from the toxic effects of chemotherapy. So you should always give high protein and calorie dense diet to the kid and don't deprive them of it. And thirdly, they usually ask whether they can give some food which will help in curing chemotherapy. Like there is a myth that green tea can help in chemotherapy, some of the berries can help in treating the cancer. So these food items usually they'll not help in curing the cancer, so they will not have any additional effects on the treatment. So these things should not be done. So what can be done is giving adequate balanced nutrition to the child. What we follow is called a plate method. Half of the plate should have a good amount of vegetables and fruits, and 1/4 of the plate should have cereals, like it could be rice, chapati, ragi, anything. And another 1/4 should be full of protein, like it could be curd, paneer, cheese, or any chicken or any good source of protein. So this is a balanced plate which has all adequate amount of carbohydrates, proteins, fats, vitamins. So each meal should consist of this balanced plate. Apart from this, good amount of snacks, high protein snacks like soya nuggets or any paneer cubes or cheese can be given to these kids so that their protein intake increases. And if any child requires additional supplements, if they're not able to meet any protein requirements, we supplement protein in the form of formulas or protein powders. So those can be given as snacks in between so that calorie dense and high protein diet can be achieved. So apart from this, as we discussed earlier, any raw foods or uncooked food is not allowed in the child because they contain a lot of bacteria, and because these children are have very low neutrophils in their body, which helps us to fight against the infection, and their immunity is very low. Any food which is uncooked and raw should not be given to these children, and unpasteurized dairy products should not be given to these children.